What is going on, everybody? My name is Hussein Aziz. Welcome back to the Everything You've Got podcast. If it's your first time here, welcome to the show. You're probably anticipating my conversation that I had with my guest. I'm going to get to that in just a second. I just want to give you context here and give a proper intro to my guest, because what ended up happening is in the actual live recording, I totally botched the intro. I got a little intimidated, went total airhead, deer in the headlights, and I couldn't see my notes for whatever reason. And although they're right in front of me, and I totally missed giving him a proper intro. So I want to give him a proper intro because I think he deserves it. My guest was Professor Douglas Allen, who's an economist and an economics professor at Simon Fraser University. He's coined some amazing research papers, and the one that I specifically brought him on to discuss with me was this one right here: COVID lockdown cost benefits, a critical assessment of the literature. Now, one of the things that caught my eye when I read this was in his abstract at the very beginning. He finishes off, he says, "It is possible that the lockdowns will go down as one of the greatest peacetime policy failures in Canada's history." Now, he wrote this back in 2021 at a time when I think you guys remember everyone was saying the complete opposite, at least most institutions, official government institutions and official universities. So I brought him on to discuss why he thought so and how his research can prove that to be true. Enjoy the conversation. My first question actually is, we'll get into the paper in just a bit, because you wrote a paper that I think that you're currently pretty well known for, which did a cost and benefits analysis on the COVID lockdowns. And that's essentially what I wanted to chat about. We'll jump into that in just a second. But I first wanted to ask you, I feel like you have a difficult job today. I think economics to the average person, for lack of a better term, can sometimes be a little dry. And combined with, I assume your students are, generally fairly young today, maybe in their early 20s, and combine that with the amount of TikTok and Instagram and all that stuff, I think they have broken brains when it comes to like attention span. So has it been more difficult to teach today versus, let's say, like 10, 20 years ago when you're teaching your students?
Yeah, okay. Well, that's a interesting question. The answer is absolutely yes.
Yeah, I
Um,
bet.
but there are a number of factors. It's funny you should ask such a question because um, this is a question I think that's being asked on all campuses across North America. Certainly, it's being asked at SFU. And me personally, I've been doing sort of some research into this over the last several
Mhm.
months. What's happened, there was a sudden drop in the quality of incoming student at SFU around 2005. And that sort of remained constant until about 2019. And since coming back from the pandemic, the drop, there's been about a 10% drop in the average performance of students. I mean, that might not sound like much, but that's an incredible change in performance. And students are showing up with, I mean, you'll think I may be exaggerating, but students are showing up with about a grade 7 level of numeracy, the ability
Wow.
to do basic algebra, and I'm talking about the bare basics. And they're
Right.
showing up with about a grade 9, grade 8 level of literacy skills. So I'm
And
not convinced that the average freshman at SFU has a vocabulary. And I'm talking about domestic kids. Uh,
right.
Greater than 300 words. And so
Really?
it's quite shocking. So students all they think they know the words, but they're the way they've been taught to read, I think they're guessing often. So they'll see a paragraph and they know about half the words and they guess at
Right.
the others, try to infer them. And so you can have two students read the same paragraph and they could come to the actual opposite conclusions of what they're reading. So
Right.
this has led to real challenges actually on like I say, I mean, we are wrestling with this at the university level on what to do.
100%. I can only imagine what the future challenges are going to be of these individuals that grow up into, let's say, when they become 20s, sorry, in their 30s and 40s, they become living adults. I
Mhm.
mean, would you attribute that to the fact that they have, like you said, grade 7 reading ability? Is that also a drop in standard when it comes to admission to the university, you think?
Well, the problem with the university is the university says, okay, we're going to accept students with a 93% average or whatever coming out of high school. The
Hmm.
students got a 93% average out of high school. at least on the initial waves of students, you say, it's really not the fault of the university. It was the fault of the public system. Now,
Right.
if year after year, we realize that 93 is the old 72 or something, then
Right.
it becomes a problem for us, right? We have to make adjustments. We either have to, well, this is the question that we're dealing with, right? I mean, do we just accept what we're being given, or do we try to do something else? I mean, if you can believe it. So I've been teaching for 40 years. I've been teaching
Wow.
economics courses, but this fall
Right.
I'm teaching writing.
It's
And
that seems like
I still can't wrap my head around that. I'm actually teaching a course on writing.
right.
And it's really going to be like a grade 10 level course. I mean, what a waste of resources, but the department has been sort of
Absolutely.
forced to do it. I mean,
So, okay, I
now,
think that
let me also point out the pandemic seriously contributed to this problem. So, in the sense that for the last 2 years, 2.5 years, a lot of students, even if they were in school, it's hard to know what was actually going on there, right? Were they being graded? Were they being, were they required to attend all the time, etc.? But I think the problem is actually bigger than that. I think, like I say, there's been a drop in quality going on for about 18 years. And
wow.
so I don't think we know the real reason.
Yeah, I think it's contributing to a lot to the chaos that we see. It's very subtle. I think the change has been very, very subtle, but the much more bigger pieces of the pie, I think, will kind of really reveal themselves as time goes along. Now, I think the way we started. I think this conversation could be one we could probably talk about this all day in terms of what's happening at the universities and among students. But I do want to get into very much the reason I kind of invited you on to the podcast today because I've just been very curious to see. I mean, I had a fairly straightforward perspective in terms of what was happening during the pandemic, and I was very clear and vocal around my friends and family about what was happening. But I'm not a professor. I didn't use any sort of you know I didn't have a lot of I don't have any history in doing conducting any studies and seeing. So whenever a lot of people like me would kind of speak up or say certain things, you would be met with a lot of resistance because we'd lack everybody would say we'd lack the understanding of what was actually going on. So I want to jump into the first part of my question here was, when we looked at the media and the TV, that was very much where we're getting our information from, where a lot of policy was being brought up from, and they were using we were seeing a lot of images and numbers thrown at us, and I found so intriguing that in the beginning of your paper here suggested that a lot of those models were flawed. And one of them was is it the SIRS model? I think you brought up that had some major flaws to it in the way that they recorded the data and the way they presented to it. If you can kind of elaborate for the audience, for us smooth brains out there, and kind of really help us understand what really was the flaw and what was the challenge in trying to, and what was wrong with trying to derive public policy out of using those models.
Okay. So uh, you have this field called epidemiology.
Right.
And epidemiology is sort of the study of disease and viruses and how these things progress through a population. And when the coronavirus came, the question is, well, what's going to happen? How fast will this move through the population? How many people are going to get infected? Of the people that are infected, how many are going to die? Et cetera, et cetera.
Hmm.
And in epidemiology, they use a model that has these initials SIR. S stands for how many people are susceptible, how many people are vulnerable to the disease. I stands for how many are infected, and the R stands for how many are recovered, and called a SIR model. And so they use this SIR model to estimate what we call a counterfactual. The
Hmm.
counterfactual is what's going to happen if we don't do anything. What would happen if we do policy X? What will happen if we do policy Y? And these models, are fundamentally flawed when they're
Right.
applied to human beings. Now, I'm not an epidemiologist. I'm an economist. So you might say, what's
Right.
my expertise? But, you know, an economist, like an epidemiologist, we're really part of our training is in applied mathematics. And so there's nothing special about these models. They're just a series of equations. And if you understand equations, you can understand these models. So it's no problem for an economist to look at the
Right.
model. So these models had all kinds of problems. I'll briefly mention a couple, but I'll focus in on the major one.
Hmm.
So these models have what are called parameters. These are values, assumptions that they have to make. One of the assumptions that they have to make is, for example, how many people are susceptible. And these models assumed that everybody was susceptible, that this was a completely novel virus and nobody had any immunity. When in fact we learned pretty quickly that lots, maybe 40% of the population was already had enough T cells from previous related viral infections that made them immune. Uh, they assumed that if you got infected, there was some probability of dying, and they assumed that this probability was the same for everyone, when in fact it absolutely was not. And they assumed that this probability on average was 0.9 of a percent, which was about 9 times too high. So they were assuming too many people would die. And then there was another parameter assumption that turned out to be really critical. It's called the reproduction number. This is the R value. This is
Right.
this, if I infect you, how many people will you infect? And it assumed basically, I think it was 2.5. So for every if you get infected, you'll infect 2.5 people.
Right.
With a number like 2.5, the virus just explodes in the population. All of that number turned out to be what we would say endogenous, and it very quickly went to one, which we can talk about, and the reason why. So on the one hand, the model was sort of rigged right from the beginning to come up with numbers that were really big.
Right.
But here's the biggest problem. And this is going to be true about every kind of model, whether it's coming from a physicist, a biologist, an epidemiologist, a medical doctor, or whatever. These disciplines that are not fundamentally studying human behavior end up always treating human beings as if they're rocks and
Yes.
they don't respond to anything. And so
Right.
in these SIR models, that's exactly what they assumed people would do. The virus would come along, and you would not change your behavior. You would go to the store every Tuesday, like you always did. You would shake the hand of the grocer. You would hug Mrs. Smith, your neighbor, and you would just continue to behave as you always did. When, of
Hmm.
course, that's foolish, right? If there is a madman running around with a gun, you don't behave as normal. You go and hide. And when there's a
Right.
virus around that's killing people, you change your behavior. And
Right.
this turned out to be the absolute critical big flaw in these models. So the model that got most of the attention early on was a model that came out of the Imperial College of London, developed by a physicist who turned epidemiologist, a guy named Ferguson. And that model for Canada predicted in March of 2020, it predicted that by July of 2020, just 3 months away,
Hmm.
there would be 266,000 people killed by the virus if we did nothing.
Right.
Now, just think about that for a minute. That's an incredible number of people.
100%.
Now, the other thing that it predicted was it said that even if we locked down tight as a drum, if every single person was sent to their home and the door was welded shut, that there would still be 132,000 deaths. Now, stop and think about that. That's incredible. Uh, if that were true, that would be as bad as the Great Plague of London, or the smallpox in the 17th century.
Right.
If that were true, I mean, you would have some sort of grounds to panic. Now, by July of 2020, in Canada, there were not 266,000 deaths. There were not
Yeah.
132,000 deaths. There were
Right.
9,000 deaths.
Right.
9,000 deaths. Um,
So,
Now, so right off the bat, in July of 2020, we should have said these models were off by a factor of 15. They're fundamentally flawed. Maybe we don't know why they're flawed, but
hmm.
they've been refuted. They're wrong. We should stop listening to them.
Right.
That would have been that would have been the right thing to do.
Right. So that's a great point, and that leads me to my next question. Based like what I was reading here, it's you lay it out so clearly and so simply, and it what how is it that some of our, highest government officials sitting there making these decisions did not understand this? I mean, you were sitting at home doing the study by yourself, and they had an entire team, from what I understand, at least the way that they're making it sound. You had three, four doctors show up every single day in the background, giving us updates on what's going on. Yet, how is it that they miss such simple, at least from the way that you're explaining, is such simple factors that they just didn't consider? It seems like.
Okay, this is my opinion. I think
Absolutely.
I think everybody understood it.
Right. Right.
Everybody knew it. Uh, there's a fascinating editorial in the New York Times, which was one of the
Hmm.
biggest promoters of
You're
lockdown.
right. Yes.
Uh, it's on March 20th
Right.
of 2020. March
Right.
20th of 2020. That's about 9 days after the the WHO declaration of a
Right.
pandemic.
Right.
That article is written by an epidemiologist, and the epidemiologist by this time has already had. He's got the data from the Princess Cruise Line, which turned out to be a fantastic data set because when you're calculating what's called the infection fatality rate of the number of people infected, how many
Right.
die, you need
Right.
to know the total number of people that are infected. And that's a
Right.
very hard number to come by because the only people that you see at the hospital are people that are sick. The
Right.
people that got infected and never got sick don't show up.
Right.
So it's a very hard number to calculate. But here we had the population. We had we knew the entire ship manifest. So we knew the total number of people that were infected, and we knew
Uh-huh.
how many were dying. So
Uh-huh.
we had a very good estimate of the infection fatality rate, and it was
Right.
nothing near what the models were having. We not only knew that, but this epidemiologist had the data from South Korea. You may not know about that. He had data from Italy, and he had the early data from Holland. So he
Hmm.
already had a lot of data about what was going on,
Hmm.
and enough data to know one of the crucial factors of the pandemic is that the infection fatality rate was not constant across age groups. In fact, it was radically different across age groups. And it does this. It's basically zero for people under 20. It just slowly increases until you get to about 62. And then it does this, takes off. You're at age 70, you're about 1,000 times more likely to die of COVID uh,
Right.
than somebody who's 20.
Yeah.
That's a really important thing to know because it means that, there's no real reason for locking down a 20-year-old. There's no real reason for locking down a 6-year-old. In
Hmm.
fact, what we knew from all our history of dealing with viruses in our human past was that those people should be as exposed to the virus as quickly as possible. Because when those large numbers get exposed to the virus, they create a herd immunity. We
Hmm.
reach an endemic state, and that protects the vulnerable people.
Hmm.
Um, anyway, on March of 2020, this epidemiologist he writes in this thing. He says, "Oh, we've got the data now, and it's great news. We don't have to do these radical things. We can do what we've done in the past because
Right.
there's nothing really special about this virus. We need to
Hmm.
just we need to sort of protect the vulnerable people until the rest of us get infected."
Right.
So, that's right at the beginning. Everybody knew there's nothing. You talked about having to check Wikipedia and things. There was data almost available immediately if you were willing to look for it. And like I
Right.
say, if I can find it, the public health officers could certainly find it as well.
Right.
And so even if they didn't know it by the end of March, they certainly knew it by the end of April. If they didn't know it by the end of April, they absolutely certainly knew it by the end of May. And of course, by July, they certainly knew that the models were absolutely wrong.
Right. Yeah, I love observing human behavior. I love observing myself. I like to just kind of and be self-aware and see what's happening. And it was so funny when it all took place. You saw people rushing to the stores for toilet paper, which I couldn't understand, and everyone's reactions that were taking place. It seemed like to me that people were reacting emotionally and then using their rationale to reinforce how they were feeling as they were going. And this kind of contributed to this whole thing that was going on when they first announced the lockdowns here in BC. What was your initial response like? How did you feel about it? Did you think it was a good move? Were you someone on the side that like, okay, let's shut her down and see we don't know what's going on. Should we collect data? Or did you think it was an overstep from the very beginning?
So let me first just address your first point about toilet paper and rushes on the meat and all the
Please.
rest of it. Um, I don't think that was an emotional response. I think that was a very rational response,
Really?
given the information that people were being fed, right? Uh, so if they're being told that there's something like smallpox around, if they're being
Right.
told that 250,000 people are about to die, uh,
Right.
you don't wait for the government to lock you down. You want to lock down immediately, but that means
Right.
I need toilet paper for 6 months. Um, and if I know that you're going to get to the store 5 minutes before me and take all the toilet paper or all the meat or all the Advil or whatever, I'm
Mm-hmm.
going to get there 10 minutes early. And so it's
Mm-hmm.
very rational for people to respond that way, given if they believe the information they're being fed. And this is, of course, is one of the great tragedies and one of the early costs of the pandemic is that we were fed information that was wrong, and we were fed
Right.
it over and over again, and that
Right.
induced rational responses that turned out to be really serious. Now we can talk about others later on about these long run costs that happen, but there were
Right.
people that said, "I'm not going to go see my oncologist because I might die of COVID on the way home." Well, it turned out that they died from liver cancer the following, 8 months later.
Right.
So, so in some sense, maybe people should have been more aware. But if you trust your public officials and they feed you misinformation, then of course you're going to make false choices. Now, back to your question.
Right.
I can still remember the day that we locked down for the first 2 weeks to bend the curve. I was driving home, listening to
Mm-hmm.
it on the news,
Mm-hmm.
and my up until that point, I just thought, what's the big deal here? I mean, this is
Yeah.
just, this is a coronavirus. We live with coronaviruses all the time,
Right.
rhinoviruses. We live with about 200 viruses. I mean, I'm sure it's bad, but I mean, H1N1 was bad, and we
Right.
got through that.
Right.
Uh, so on the way home, when I heard we were locking down, I just thought to myself, I must be wrong. It must be that this is smallpox in 17th century, or this is the bubonic plague or something.
Mm-hmm.
And so in the first week or so, because of my reaction was, they must be aware of the incredible cost that they're about to impose on the world. And so there must be an incredible danger. And so for the first week or so, I kind of just went along with it.
Mm-hmm.
Um, but that started my research quest. And so
Yes.
maybe because I'm a data guy, theory guy,
Yes.
I immediately found, the sources of data that I could look at. And I was immediately struck by, well, wait a minute here. uh,
Right.
this doesn't make any sense. I mean, I
Right.
was looking at one of the first things I was looking at the data across the U.S. and I was saying, these states are behaving very differently,
Right.
but the virus isn't behaving very differently,
Right.
and so the actions of the state don't look like they're doing much. Anyway, but I was almost immediately, certainly by the end of April of
Yes.
2020, I was deep into this stuff.
Right. So did you now in your paper you talked about how, people there were some people who voluntarily changed their own behavior, and there were some people who didn't comply to all the lockdowns. So it's very difficult to assess if the lockdowns were effective. Did you find yourself changing your own behavior, and for how long? Did you stay home? Were you afraid to go outside? Did you put on a mask? Did you wear gloves?
Um, so I went to work after the first couple of days. I went to work. I went back to work, and
Right.
I stayed there the entire time. There are at my building at SFU, there are only three of us that did that, and I always
Really?
joke, yeah, there's only three of us.
Oh
One
my
grad
goodness.
student and another faculty. It was kind of nice actually. I had the whole building to myself, but I used to joke that I should be charging SFU for security because there are all these computers and labs all over the place, and I was sort of one walking the hallways, making sure everything wasn't being walked away with. But
My goodness.
um, I was very much opposed to mask mandates. Um,
Right.
I got a medical exemption. Don't need to go into that, but I had a medical exemption from wearing a mask. So when we went back in the fall of 2021, I did
Mm,
not wear a mask. Um,
right. Yeah, it's interesting you say that. Neither did I. I think I was. I was in like this unique category where when the lockdowns took place, I was still like my job where I was working still kind of kept me out and about. So for the entire lockdown, I my schedule was still, Monday to Friday I was going out, and and it was just so interesting and very shocking to see how quickly people's, behavior changed so fast. And
Yeah.
I'm talking like just basic understanding of how we all interact.
Again, I think if everybody believes the masking is kind of an interesting thing because everybody remembers initially the public health officers were saying, look, don't worry about a mask. That's kind of ridiculous. These masks that people are wearing were designed just to keep spit out of the abdomen of from the surgeon. That they were never designed for a virus.
Yeah.
Thinking that those little paper masks were stopping a virus that have leaks all over them is, the metaphor. It's like thinking you're going to stop a mosquito with a page wire fence. Um, but so initially, but eventually that metaphor turned around, right?
Right.
And it turned out that no, masking is really an important thing to stop viruses. We know that's false now, right? I
Yeah.
mean,
Yeah.
uh, but we knew it. We knew it. We knew it was false for other respiratory viruses before the pandemic, and then it
Right.
became, well, who knows about coronavirus? Now we know. There's no evidence that masking did
Yeah.
anything.
Well, I remember Dr. Bonnie Henry coming out before they even made the mask mandates on TV saying we're not going to mandate masks because we know they don't work, they're not effective. And then a week later, everyone goes nuts, and you
Yeah.
almost started to not believe what you were seeing and hearing anymore because you didn't know what to believe.
I've written a couple other papers on COVID. One about is why did things roll out the way they did, and
Right.
my own view, again my opinion, is that the role masks played was not to prevent the virus from transmitting. Nobody believed that. I don't think any health officer really believed that. It was to instill sort of a fear. It was sort of to reinforce this idea that, as our health minister said over and over again, death is at your door. Death is at your door. Death is at your door. And
Mhm.
when I see somebody with a mask, I even subconsciously, it reminds me, hey, there's danger around. Maybe I shouldn't be here, etc.
Right.
It was a way of establishing and maintaining this fear amongst us that
Right.
we need to be following the orders of the state.
Yes, and that's what I was initially early on when I said I cut. That's you made a very interesting point, and I do agree with you. I think I was maybe a little overzealous on the people responding emotionally, but that's kind of what I meant is that when everybody heard these messages, the emotion, the overarching emotion, collectively, I think if you recall, in the city was fear. Everyone was afraid,
Right.
and based on that emotion, I feel like they began to go out and get this, overbuy, over absorb in terms of what was going on in the markets, and
So if you really believe that even if it's the fall of 2021, that's what if you've been locked down for 6 months, you watch the news every night, people that you've always trusted, the news anchor, your
mhm,
public health officer, your minister of health, if every night they're telling you death's at the door and they're putting up these numbers, but you don't really know what these numbers have no context. Sometimes they're talking about rates, sometimes they're talking about levels, but you don't really appreciate the difference. All you do is trust these people. Then again, it's you become afraid, and then it becomes sort of a rational thing that I will still limit my activities. I will not allow certain people over to my home. I will wear a mask. I'll get angry at you for not wearing a mask,
right,
etc. It's a very rational kind of thing, but it's all premised on this fear. And the question comes, the thing that I always struggled with was why why were people unable to learn the truth? Because it wasn't that far away. There was
right,
a website that I just preached over and over and over again. It's out of the University of Maryland. It's
yes,
a legitimate site. Academics use it all the time. It's called Our World in Data. If you want to know anything about GDP,
right,
unemployment rates, interest rates, you can go there. But they documented COVID statistics from day one. It's very easy to use. You can pick your jurisdiction. You can pick the variable you're interested in. The number
mm,
of infected, the number of deaths, on and on and on. There's dozens of things you can look at, and so it's right there. Anybody could look. I would be watching the news in 2020 and 2021. I would have my laptop open, and when I would hear something being said, I could just
Right.
instantly check, are they being honest or not?
Right.
Um,
You know,
but
I have a
most people just didn't look.
yeah, I had a I came up with I had a little theory on that, and it'd be interesting to hear your take on it. I felt like because you're right, I think majority of people were very confused. They were far removed from the truth, and they didn't really look to see. They just kind of believed in what they saw. And but then there was also people, very few, like maybe a handful, at least in my own personal life, that didn't react in based out of fear. And my theory on that is I feel like the people who did not people like yourself who kind of stood back, took a look at the data, and tried to address for themselves what was going on was that people like that had a sense of self. They had a deeper understanding of themselves, a little bit beyond skin deep. And they kind of knew themselves and had a relationship with themselves, and possibly even they had considered their own mortality long before this pandemic came through. And people who I think didn't do that, as a result, if you didn't have a sense of self, you didn't really know, what to believe. You would kind of believe anyone telling you anything at that time because you would think it's going to help you at least lower your chances of facing your own mortality in that time.
That's interesting. I did think that suppose you were a person that thought there's no afterlife or something.
Hmm.
In the purely secular way, what is retirement? Retirement is sort of like your heaven. And that's what COVID was taking away from you, right? I mean,
Right.
we eventually everybody knew it was really people over 70 that are dying
Right.
and they're losing their heaven. And so,
Right.
and it was all these baby boomers who were 65 and older. Maybe that was part of the reason why they reacted so negatively around COVID and why they would have been so upset at you for being out and about, not wearing a mask, is because you're taking away my only little heaven I've got. There's nothing after
Right.
this.
Right. You're putting
But
him.
who knows? Who knows?
Right. You said you said earlier that the real pandemic actually came to an end. If I recall, correct me if I'm wrong. If I recall correctly, actually came to an end in June of 2020. So that same year, by more or less by the end of June, the actual pandemic had already come to an end. How like what kind of data assessment did you use to come to that conclusion? Like, how did you come to that conclusion? Well, when everybody else was saying the complete opposite.
Sure. Uh, so every virus behaves basically the same way. A new virus comes in. A pandemic just means that this R value is greater than one. That's all a pandemic really means, is that the virus is sort of exploding in infecting people. And then every virus again behaves the same way. And eventually it infects just about everybody, and there's not enough people around to infect. And so the R value starts to fall, and eventually it settles around one. And the reason why a virus like a coronavirus settles around one, we never get rid of it. We never get rid of it, partly because there always, there's always somebody that's unexposed or their immunity declines and they get reinfected or something like that. So there's always a certain number of people that are around that are getting reinfected. But a coronavirus lives in the animal population as well.
Hmm.
And so even if every human being got infected and every human being, was not getting reinfected, the virus still lives on, just lives on in animals. And eventually there's a human being that's born that's not been unexposed and they get it. So when the R value is around one, we call it an endemic state. So the definition of when is the pandemic over is when we reach an endemic state.
Hmm.
Every virus reaches an endemic state.
Right.
Now, so if you were to go to our world and data,
Hmm.
we could do that right now if you wanted to share your screen. But if you want to go to our world and data and you looked at, say, the world, you could pick any country you wanted, but if you picked any country you want, and you say, let's plot the R value from March of 2020 until now, you would see
Right.
what happens is it shoots up. And then by the end, I think it's before June, it's like the end of April or early May, it hits one. And then it kind of hovers around there.
Right.
And well, that means we reached an endemic state. Now, here's the thing. Why did we reach an endemic state? We reached an endemic state because of changes in behavior.
Right.
So I call it a behavioral endemic state. That when the virus is above one, when the virus is very active, a lot of people just stay home. They're really careful. And when the virus dips down below one, and a couple weeks go by, people just start going out. They have parties. They do whatever, and the R value goes up. And so this thing just hovers around. Now, eventually, what happens though is again, there's nothing. The coronavirus was just so typical of how viruses proceed through a population.
Hmm.
Uh, the virus, viruses mutate, and in order for the mutation to take over, one has to become less lethal, and it
Hmm.
has to become more infectious. And eventually, you know what happened in the fall, the Christmas of 2021, early 2022, Omicron came along.
Yeah.
Omicron was super infectious.
Right.
Initially, there were estimates that the R value was like 17. That means like a population like British Columbia, if we were one social unit, we'd be all infected in 3 days.
Right.
So, and if you remember at the time, everybody got infected. And so we reached this behavioral endemic state very quickly.
Right.
But now we're in what's called a biological endemic state. We've reached a state where everybody's been infected or
Right.
vaccinated
Right.
or have some hybrid immunity. And so, the virus has got really nowhere to go except for, birds and deer and the odd human being whose,
Right.
immunity declines.
Did you get infected yourself by any chance? Did
I
did you?
did. I think I was infected 3 times, but the first time was kind of funny. So in January of 2020, I had a friend in Seattle dying of cancer, and so I went to see him. And when went down to see him, he was in isolation. But they
Right.
said, "Yeah, go in there." So I sat in a room with him in isolation for 2 hours. And at the end of the visit, I said, "Boy, what do they think your cancer is contagious or something?" And he goes, "Oh no, I've got this thing called coronavirus." Oh, what's that? And he goes, "I don't know. It's like he says, I feel like I've got the a cold, bad cold."
Right.
And about 5 or 6 days later, I just came down with a nasty, nasty cold, and I never still even didn't think about it. And
Right.
so that was before you kind of knew what was going on. So I probably had it then, but I did get it officially. I got the Delta variant in November of 21, and I got the Omicron in late December of 21. So I got them back to back.
Right.
Uh, and interestingly enough, all three came from interactions at a hospital. So my daughter had a baby in November 21. I went to visit her at the hospital, picked up
Right.
coronavirus, and then that baby got sick 6 weeks later, and I took him to the hospital and got it again.
Right.
So hospitals for me turned out to be the most infectious places.
Right. Okay, so just for sake of time, I do want to get to two more questions. I'm not going to get to all of them, but there's a couple questions left that I wanted to ask, and one of them was that I felt like when when the pandemic began and you began to see the government officials and how they were behaving, it almost seemed like all of a sudden they assumed the entire population had turned into toddlers, as if they couldn't make decisions for themselves, as if they didn't understand, what was better for them and good for them. And it was the government and these public officials, whether they be, at any position, was the ultimate, for lack of a better word, decider. Like they knew what was best for everybody else. I guess my question would be is what kind of a government do you think it needs to be to all of a sudden make that type of shift and see your population in that light when for all of time this had never happened before, but all of a sudden you think your population is just completely dumb and doesn't understand how to behave.
Yeah, so I think your operating assumption there is wrong. Uh,
Okay.
so uh, what happened? Um, so, and we know a lot about what happened now from these lockdown diaries in the UK, and I'm sure the same thing happened to governments around the world. And I might
Right.
point out that I've written two more papers for the Fraser Institute, one of which covers this topic. So,
Right.
let's suppose, for the sake of argument, who knows, you're the government of British Columbia or Ontario or Quebec or wherever, Tennessee, the United Kingdom, this virus comes along, and for whatever reason, you believe that there's going to be 266,000, or this incredible high death rate, and so you make this radical step of locking down the population, but you learn very quickly, within 10 days, maybe a month, that you made a terrible mistake. And
Right.
now, if you were to go back to the end of March, beginning of April, into May, what
Right.
happened to the stock market during that time? It tanked, right?
Yes.
Unemployment exploded. GDP crashed. We lost about 1/3 of the wealth of the country in just a couple weeks. You were
Right.
the one who made that decision.
Right.
You, you
Right.
made it. And now what are you going to do? Are you going to say, "Oh, my culpa," slap my wrist?
Right.
What a terrible, what a fool I was. No,
Right.
you're not going to do that. There's no way you're going to do that.
Right.
Uh, you are going to do the following. You are going to say, "Well, we won. Thank God. It was a terrible thing that happened, but the virus was terrible. We won. And now look, the virus is kind of going away because what happened? It was spring, if you remember, right? Summer
Right.
came along, the virus settled down, and we were sort of like, it's all over, good. And if you
Right.
remember the summer of 2020, people were relaxed. But what happened? The virus comes back, just like every other respiratory virus. It came back in the fall. What are you going to do as a politician? Are you going to say, "Oh, we're just going to ignore it this time because we know now that it didn't make any difference"? And people are going to say, "Oh my gosh, are you telling me that I lost my job? I had all that suffering in the spring because you made a mistake"? No
Right.
way. You do what's called you double down. You say, we have to double down and lock down again. And virus comes back again, you double down again, and you double down again, and you double down. You know that eventually you are going to reach an endemic state, and then you can declare victory.
Right.
And if you remember what happened with Omicron, Omicron comes, everybody gets infected, everybody realizes, hey, death was not at my door, right?
Right.
We have the truck protest and all these kinds of things. And
Right.
what was the reaction to the truck protest?
It was
The
double.
prime minister declares, basically martial law. Why did he do that? He declared it after the truck protest was broken up. He
Right.
did it because if you're doing this double down thing, you can never let the truth out. The stakes just get higher and higher and higher, and you have to get stronger and stronger and stronger. Now, what happened, of course, Omicron was the end of it. It forced this biological endemic state. And what has happened? You
Right.
still hear it. I heard it on the news this last week that that was a terrible time we went through. We did the lockdown. That was necessary, and we won. Of course, we know now that the lockdown made no difference whatsoever. We would have
Right.
won anyway, and we
Right.
wouldn't have had to suffer all these consequences. But the
Right.
state will never be able to admit that,
Right.
right?
Okay.
They will never, because then they become either responsible one way or another.
Right.
So it's not that the government assumed that people were stupid. It's that they had to scare them and into believing them, and because the stakes kept getting higher and higher, and they could never admit. Once they went down that road, they're committed. They have to go until they reach the endemic state.
Okay, so I'm going to push back just a little bit here because I totally understand what you're saying, and I remember I was watching one of your other interviews, and I remember you hearing you say that, and I do agree with you. I think they were in a position where they did have to double down, and I think it's one of the hardest things as a human being to do in general, just even in your own personal life, is sometimes come about and admit that you've been wrong. So I understand in front of the public and all this, it's almost impossible, but I just found as time progressed and the information was starting to come out, and you're still doubling down, like at some point, wouldn't you take it as like it's almost like insulting your own intelligence that yourself, like you did a study, you you came out, showed that the lockdowns were ineffective, yet they would double down right in front of you, and then to everybody else right in front of us.
But the problem, as long as the majority of the population is on your side, you're okay, right? I mean, if the majority of the population doesn't know the truth, and you're on the news every night telling them otherwise,
Right.
that's why the population has to take some responsibility here, right? If the
100%.
population if the
100.
population had revolted in the spring of 2020, that
Right.
would have been probably the end of it. Now, the other
One.
thing is, how do we prevent this in the future? You
Yes.
can't prevent it in the future by saying we need politicians that are more honorable or whatever. That's never going to happen. What you have to do is you have to put institutional constraints in place that prevent the politician from doing this action in the first
But
place. Because
but
it's
don't we
step
already have those? Like we have our Bill of Rights. We have our that's entrenched in the
Yeah, but
Constitution. Those,
The Bill of Rights doesn't stop the government from issuing mandates and stay-at-home orders and all the rest of it. It doesn't prevent that.
okay, so
Uh,
what do you mean by putting in institutional restraints?
well, so for example, like why did Sweden do what they did? Was it because their leaders were somehow different from the other leaders? No, they have constitutional restrictions that say you cannot prevent people's movements. You cannot tell people to stay at home. They cannot. So maybe the point is they have a Bill of Rights that contains rights that prevent it, right?
But isn't
Uh,
that's Section 4 of our charter, is it not?
but I think our charter allows for, under certain circumstances, the state can. So,
Right. I guess under the Wars Measure Act and all of that stuff, the
well, but I just think, I mean, we've had numerous court cases decided that in an emergency, the state can override our charter.
right.
I have not looked too carefully into this, but right now you've got, I think a lot of states are passing laws that just prevent, for example, mask mandates
Yes.
or vaccine mandates. There are various states that are saying it is now a law that you cannot do this. You
Right.
cannot, under any circumstances, you can't do it.
Right.
Now, if the time comes, maybe the legislature will be able to override that, but at least they're going to have to override it, and there will have to be some kind of political debate. So
Right.
I
Yeah,
think that's the way we can prevent it is to try to preempt politicians from going down that road.
that's that's very interesting. I don't know if I still think that I feel like we had those restraints in place. At least we have a system in place to
Turned
try.
out turned out the rights that we had turned out to be not very much. We had freedom of religion,
Right.
and churches were shut down. Churches were shut down longer than restaurants, and
Right.
there's no provision in the Charter of Rights for restaurants.
Right.
Turned out to mean very little. We
Right.
had dates on vaccines, and it turned out that you have a right for bodily autonomy,
Right.
and the state said, well, we weren't violating that. No, you just put a gun to people's heads.
Right.
It was your choice, right? You want to stay employed, so that turned out to the court said, yeah, that's okay. So
Right.
it turned out that our Bill of Rights was not, it really didn't mean what a lot of people thought it meant.
Yeah. Yeah,
Right.
I do understand what you're saying. I do understand that. I guess we could maybe kind of create more of a robust system to limit the power at the top. But I do think it's going to have to be a blend. We are going to need maybe less corrupted hearts at the top as well, because
Everybody's corrupted. You're corrupted, I'm corrupted. There's no such thing as less corrupted. You have to design. Do you know who Justice Scalia was? He was a U.S. Supreme Court justice that died a few years ago, but he's got an interesting video on YouTube. It's a testimony where he's talking about, what every country in the world has Bill of Rights and Charters of Rights. I mean, the Soviet Union had one of the most explicit charters of rights ever written, and yet it wasn't worth the paper it was written on.
right.
And so his lecture is about what makes a charter of right work.
Right.
And what makes a charter of right work is that the government itself has to have checks on its authority, and those checks have to work. And I think what happened in Canada is we found out that we have a charter of rights that didn't work the way we thought because the government has authorities that we didn't realize
Right.
overriding. And in fact, even with the the act that was invoked, the Emergencies Act that
Yes.
was invoked during the trucker strike, the courts just said that that inquiry just said the government was justified in doing that.
Yeah, which I found was a little ridiculous. But
And well, I suppose that's true, though. Then that means that maybe we need a stronger check on the use of the Emergencies Act.
yes, this is a fascinating conversation. I think I would love to go on it for a while, but I agree with you halfway, but I still think it's going to need a blend. I think we're going to need some people to actually step up and do behave a little. I don't think you need everyone up there to be honorable and honest. That you are right. That's very difficult to catch, but I think if you have one or two, because I think one honorable and uncorrupted heart can battle against 1,000. But that's my own personal opinion.
When I first wrote that paper,
Right.
I put it on Facebook, and I only have 6 Facebook friends. I just sort of put it on there for my family,
Right.
but it went viral within a few days.
Yes.
And I was contacted by a number of politicians across Canada, both federally and provincially.
Okay.
Politicians that were on board. They didn't like what was going on, and I remember encouraging them, saying, "You need to stand up, and because you need to be like Barack Obama during the debate over the Iraq War." Barack Obama stood up and opposed the invasion of Iraq. He was the only senator who did that.
Right.
And at the time, everybody thought he was crazy, but down the road, that turned out to be his key to the White House.
Right.
I said, you have to have the guts to
Yes.
stand up today,
Yes.
and even if you will take a big hit, but 2 years from now, for certain, you will be right. Not a single one of them, not a single one of them went public.
Right.
And
Isn't that
so,
interesting? I I want to ask why you think so, but I'm just for the sake of time, I'm going to finish off with my last question, just because I want to respect your time. Thank you so much. Is when you published this paper and you were writing it, I mean, when I was watching out in the public discord and the response that was going on, I mean, at the beginning, there was the lockdown and COVID narrative that was starting to develop, and what I noticed was a lot of the institutions and a lot of official government offices very much doubled down on the narrative, and many people believed it, and especially, and you being an educator working for one of these institutions, thinking that you're going to come out and release this study that really went counterintuitive to the narrative. Was there any sort of fear or a hesitancy on your part that maybe there could be some blowback that would come your way, whether it be from your employer or from faculty members around the school?
so I'm a strong, strong advocate and believer of academic freedom. And I just, for me, that's just part of who I am. And even in my past, I've advocated for a few positions that got a lot of heat and things like that. So
Right.
I've never really been too afraid or worried about that. When it came to this thing, I did get pushback from a few people,
Right.
mostly academics, either mostly academics or people just anonymously on social media, which I just could care less.
Yeah.
Anybody who's not willing to put their name to something, I just could really care less about what you have to think.
100%.
But I was actually pretty surprised at the actual support that I got. And I actually I would call them friends even, to this day. I made contacts around the world from people from every discipline imaginable:
Hmm.
the law,
Hmm.
psychology,
Hmm.
sociology, family studies, medicine,
Hmm.
epidemiology.
Hmm.
There were economists. There were people all over the world doing basically what I was doing. I just happened to be sort of first. You know what I think? Honestly, the reason why it went viral was I just had a sentence in my abstract that said, "This will go down as one of the greatest peacetime policy disasters."
Yes, you
And I
wrote
think
that.
that line just caught people's attention, and that's why it went viral.
Right.
Because there were certain other people, nutritionists, counselors. I had people just emailing me every week about their experience, what they were going on, and the things that they were seeing, and the research they were doing. And I started a research project with a doctor in Alberta. It never really went anywhere, but it's kind of funny doing this podcast. This is the first podcast I've done since 2020, early 2022, but
Right.
I must have done a dozen podcasts around the world:
Yes.
Germany, Sweden, Australia, wherever.
Yes.
So there were lots of people around the world doing the same sort of things.
Right.
So even though I was getting some pushback from people, it was overwhelmingly, I felt supported.
That is okay. Good. Now, have you thought, being a rational, even keel, and in it to me, just speaking to you today, you sound like a very principled man. You believe in what you stand for, and for the most part, you're fearless. Have you ever thought about, at this point in your career, at this point in your life, possibly going into public office as a result?
I don't think I could get elected as dog catcher.
Why do you say that? I think
Uh,
I think you'd be
I,
pretty
I,
hard.
I just, it's like you say, I speak my mind all the time, and I get in trouble with my family, with
Right.
my friends. I just,
Right.
with my students, I always tell my students, I'm going to be kind to you. And what that means is I'm always going to be honest. But being honest is often not nice. And
Yes.
so when I tell you, you have no clue what you're talking about, you're getting an F.
Oh, I love it.
I think that's kind, because you should not be in economics, but it's certainly not nice. And yeah, I think that's exactly the opposite kind of person for a politician.
I
No, I think we need to stick to our wheelhouse, right? And I'll just do what I'm doing, and if that's useful, fine.
I slightly disagree. I think we're in desperate need of individuals like you.
Yeah, but I've never get elected, so what really would it matter?
I mean, who knows? You never know until you try. It's interesting. I might have one of the mayors for the
Plus,
show.
plus, you'd have to live in Ottawa. I lived there for 2 years. I could never go back.
Yeah,
Too cold. Too
I'm
cold.
from Toronto, and I ain't ever going back either. This is the one haven in Canada. But okay, good to know. Thank you so much, Professor, for having this. I thoroughly enjoyed the conversation. We really started to pick up some momentum towards the end. I wish we can go on for another hour. I have some questions, but if you're ever open to it, you're always welcome back onto the show. And thank you again so much for coming on, and hopefully we speak again.
All right. Thanks a lot, Hussein.
Have a good day.
You too.
Thank you. The journey inwards is the doorway to every source of freedom imaginable. But to go inwards is going to require one thing. Everything you've got. My name's Hussein, and this is the Everything You've Got podcast.